Well, we're standing here on a rather rainy or drizzly, typically English afternoon here in the courtyard at St. John's University, and with me today is Ross Wilkie. Dr. Wilkie has come all the way from Australia to attend this combined international meeting. What are your impressions of the meeting so far? What do you think?
I think it's at least met the objectives as put on the program. I think that the discussion is excellent, and one or two people didn't manage to turn up for presentations owing to illness, but apart from that, and they're the sort of things you must expect at an international meeting, I find that meetings such as this are for me an internal audit process, because I'm able to assess where I'm going and where other people are going and where other people are not going, and it's really the only way to keep in touch. And it's wonderful to have the internet and visit the websites, but to come to this venue,
right,
and in this beautiful surroundings, as someone said, it makes you feel cleverer than you are.
There's certainly no substitute for the personal exchange of information, the ability to assess what you're doing and to get some sort of yardstick to know where we're going. Don't you agree?
I think that's true, and I think that the educational psychologists who run the CME program in the United States recognise that meetings that are 9 to 5 in scientific content and don't allow adequate time for discussion are not going to get the points that they thought they were going to get. And I think our format of having adequate time in workshops and in formal discussions is working, and long may it continue.
Ross, what do you think about the future? Where do you think spinal surgery is going over the next 5 to 10 years?
My interest, spinal surgery, I think, is certainly going to move towards narrower channel endoscopes, improved materials. I think that spinal intervention is really where we're going. It might not be surgery as we know it in the current sense.
So if I understand you correctly, we're sort of on the same wavelength. We're looking at minimally invasive surgery or eventually replacement of surgery by chemical means.
By chemical means and by means to relieve pain, but also a means to improve function. I think that a lot of the meeting has concentrated on pain improvement, but I think the public are going to want more.
One of the things that we rely on in our practice, and I expect you do as well, is the patient input. And we feel strongly that if our patients are educated to what's out there, they can also help us determine what's wrong with them. Do you see it that way?
I do. I think if we aren't listening to the market, then we're kidding ourselves. In essence, we're all patients, aren't we?
Yes, we are.
We would like others to treat us the way we'd like to be treated ourselves.
Very well said. Ross, thank you so much for joining us. I appreciate it. Thank you.
Thank you, Larry.